Hi, and welcome to the latest episode of The Pig Edge, Teagasc's pig podcast with me, Amy Quinn, where we are bringing you the latest news, information and advice to keep Irish pig farmers up to date. There's no one more aware than you, the pig producers, of the importance of animal health in the pig production systems and the challenges that are on the horizon for producers. So on this episode, I'm joined by Superintending Veterinary Inspectors Dr. Garvan and Dr. Damien Barrett from the Department of Agriculture, Food and the Marine, who are here to talk to us in advance of Animal Health Awareness Week. We're going to discuss what farmers can expect from the week and the upcoming challenges for producers, including the new legislation on veterinary medicines coming into effect in January 2022 and the ban on zinc oxide from June 2022. Caroline, Damien, thanks very much for joining me today. Damien, Animal Health Awareness Week takes place from November 18th to the 24th. What is the main objective of this week and what events will be of particular interest to pig producers?
Animal Health Awareness Week, the original objective of this week was to hold an event to raise awareness among livestock farmers and their vets about the importance of animal health. And it came about as a result of a review of our early warning surveillance systems for exotic disease. Those early warning surveillance systems, it's important that we detect these exotic diseases as soon as possible so that they can be brought under control quickly. This year, for the first time, we're also incorporating World Antimicrobial Week into this as well, because good animal health and reducing antimicrobial usage are inextricably linked. So that's the basis for the week.
Caroline, Damien referenced their World Antimicrobial Week. What are the objectives of this week in relation to pig production?
I suppose, Amy, the objectives are to build on the awareness that's already out there in relation to, I suppose, the focus particularly on the intensive sectors with regard to their use of antimicrobials. And this World Antimicrobial Awareness Week, it's a global event. It's been around for a number of years. And the 18th of November is European Antibiotic Awareness Day. And to mark this as part of this overall joint initiative for the week, we are having a specific AMR webinar. And of particular emphasis in this webinar will be the pig sector. So we'd be really keen to promote this to your listeners, in particular to your pig farmers, because we have a pig farmer speaking on the event. And he is outlining how he managed to reduce his antibiotic usage on his farm by 98%. So it's all about peer-to-peer learning and sharing of positive messages. And he has kindly agreed to come on and outline the strategies that he implemented at farm level and the very positive outcomes he had by being able to reduce his antimicrobial use. But at the same time, it didn't compromise his overall pig health, his performance and his sustainability of his business, in effect. So he will be speaking, and he will also have his vet and his nutritionist speaking, because it's very much a holistic collaborative approach that's needed on pig farms. I think, the industry has been under a lot of pressure. We know there's a lot of changing requirements around welfare, and it's to try and support the industry and the sector by sharing this kind of information. And you can never be too informed, if you like. So it's to build the awareness, but we'll also be talking about it from a human health perspective, because pig farms will be aware that we carry out surveillance every second year, looking at prevalence of salmonella and resistant bacteria in our pig herd. And the findings are published in a European report for all our possible trading markets to look at. And it's fair to say that the trends in the Irish pig sector are not good for salmonella resistance. We have quite a high level when we compare to other member states. We're certainly 10 to 20% higher than a lot of other countries. And then we have the challenge of, in particular now, there's a multi-drug resistant salmonella strain that we have here. And I suppose the issue is that this strain can be detected now with new technology like the whole genome sequencing. If someone falls ill in Germany or wherever, the source of that salmonella that caused that disease can be traced right back to the actual farm. So, there's a lot of challenges out there, and really what we're trying to do is promote positive interventions that can really deliver for pig farmers.
2022 is going to be a big year for pig producers, with many changes coming down the line, including the new EU veterinary medicines legislation coming into effect in January. Caroline, what do farmers really need to know in advance of this?
Well, they need to know that AMR was a key driver behind the content in the new veterinary medicines legislation. And so what this means is this legislation is driving towards reducing your overall use of antimicrobials in all sectors. But I suppose there's a particular emphasis. There's a medicated feed new piece of legislation. And in that, it strictly bans the preventative use of in-feed medication. So this is going to have a significant impact for pig farmers, where perhaps up to now, there has been maybe an over-reliance, or I suppose a routine use in some cases potentially of in-feed antibiotics. This will no longer be permitted. There will also be restrictions on the quantities of antimicrobials that can be prescribed by the vet. Very much the legislation says that only the quantity necessary to treat the disease, but we are well aware, and we've had a lot of engagement with the pig IFA on this, and that there is a requirement for pig farmers to have some medicines available on farm to use when they can't always get a vet out. So there will be a provision to have a small amount, but certainly not 10 or 20 bottles of antibiotics. Well, it depends on the size of the herd, but it's just to basically where the legislation is going is it's clamping down on overuse or misuse of antibiotics. The other challenge, I suppose, Amy, is the zinc is going to be gone from July of next year. So obviously that is going to be a concern for farmers. And again, I direct you back to our speaker at our webinar, and he can speak of his experience with zinc, and very much looking at nutritional strategies to address any challenges you may experience when zinc is taken away. But I think that the message for pig farmers is not to be intimidated or afraid of the changes coming down, but to work collaboratively with their nutritionist, their Teagasc advisor, and their vet, so that there can be a sustainable future for the industry, because current practices really are no longer sustainable. There's a huge focus on human health impact of use in animals, and certain classes of antibiotics, I should have mentioned, are considered drugs of last resort in human health. And so from going forward, it would be expected that these would only be used in exceptional circumstances on pig farms when nothing else will work. So there may be an expectation of farmers that they will still have, these antibiotics on a shelf to use. They won't. The vet will be under scrutiny, if you like, to only prescribe them when they're absolutely necessary. And if there is a justified need for them, no one is saying you can't use antibiotics, but what we're saying is we need to kind of change our behavior and our attitude to them, because the human health situation is just getting too serious. And we will have a hospital consultant speaking, and also a GP, and they will be talking about their experience of AMR and the dilemmas they face when they have people coming into them and they have antibiotics that won't work, and where they can go when they're running out of disease treatment options. So it's to put it in context for the pig industry.
Caroline, you mentioned about the zinc oxide ban coming in next year. That's going to be coming in June 22. What effect do you think that's going to have on antimicrobial usage?
Initially, you would expect that possibly antimicrobial usage may increase, but I think as we'll discuss during our webinar, the particular pig farmer that will be talking, he was able to remove the zinc successfully from the pig diet without any adverse consequences. So there is this fear that antibiotic usage will go up, that the piglets will develop severe scour, but I think there's solutions to this. So there may be a transient increase, and then I think when people develop alternative strategies, maybe working on diet and maybe keeping the piglets slightly longer with the sow, things like that, I think overall the effect of the zinc will balance out within 6 months. I don't think we will still have that need to use increased amounts of antimicrobials.
But I suppose what we're learning, I suppose, from a lot of the research being done on farms at the moment is that the effect, I suppose, is quite variable. What do you think the farmers can do to best prepare for this? Because they mightn't all be as lucky as some producers who take it out and who have minimal effects.
I think, again, it goes down to working with your vet and your advisor and your nutritionist to see what strategy works for you. Completely agree, it will be variable because diseases on all farms vary and the immune status of the pigs will vary. But I do think it is possible. I mean, the zinc was just having too much of a negative impact on environment and other issues. So I think it will make us face maybe the disease challenges more that are present on the farm, but there may be, as I said, a transient increase in antimicrobial use from July onwards, but I would expect it to settle down.
Okay. And what DAFM support is available for farmers to reduce their antimicrobials and remove zinc oxide?
There will be an extensive communications campaign to explain what the changes will mean and how they will be implemented. So that's the kind of support that will be there. I suppose we have currently got TASA programs running, both in relation to the biosecurity. And I mean, biosecurity, again, is key. And the farmer that we have on our webinar will be talking about how improving his internal biosecurity has significant impact on his ability to reduce his overall antimicrobial use. It definitely is part of it. So, I mean, we would be encouraging farmers to get their biosecurity assessment done. So, you know, I suppose all those kind of engagements are built into the support package.
Caroline, pig producers have made great strides both in recording and reducing antimicrobial usage over the past few years. What, in your opinion, are the key factors for producers looking to reduce their antimicrobial usage further?
I think, Amy, vaccination is a key tool, and it's to look at your vaccination program and develop it as much as you can, because although there is an initial cost with the vaccine, again, it has shown that investment at that stage of production pays dividends. So I would suggest increased use of vaccine. The other key thing is reducing stocking density. Now, that's an easy thing for me to say, but, you know, if there's any possibility of reducing stocking density, then you've got better ventilation, you've less stress on the animals. So those kind of husbandry management factors will certainly feed into reducing your overall use.
And would you be able to describe the main risk factors, I suppose, for high antimicrobial usage on Irish pig farms?
I suppose the main risk factors would be overcrowding, poor ventilation, reduced vaccination, and hygiene practices. If you're able to leave a house empty after cleaning it out, those kind of things, you get a buildup of disease on all farms. And salmonella is an ongoing issue, and we know how complex that is. We have a salmonella TASA in the process of being developed as well. So I suggest, that farmers engage with the pig health check program and take advantage of these schemes to further their knowledge of what they can do and tailor an animal health specific plan for their herds.
Caroline, work published this year from Teagasc shows that respiratory disease, specifically influenza, pericarditis and lung abscesses, are among the main risk factors, along with, I suppose, finisher mortality. So factory data will obviously play a key role in improving animal health and reducing antimicrobial usage. Producers are currently eagerly awaiting the introduction of the AM/PM system. Can you explain this system to us and give us a timeline for when it will be operational?
Well, as far as I know, Amy, the AM system is already operational, so farmers should be getting data back regarding ante-mortem findings. But I suppose it's the post-mortem findings which will yield the most information, and that system is due to roll out early next year. There has been some delays, but we're very much focused on having all this information in the one area, if you like, and that's going to feed into the whole pig health check dashboard, because that will also then be able to measure, your incidence at post-mortem, and then you'll be able to reference back to your antimicrobial use. So it's bringing it all together, but I suppose it has been delayed, but we are hoping that the post-mortem data will be available early next year.
Okay. Damien, producers, I suppose, are well aware of the risk of African swine fever. Would you have a current update for us on this?
as you're all aware, that this is probably one of the more devastating exotic diseases that can affect pigs. Thankfully, it hasn't reached our shores, and hopefully it won't, because we are aware that there may be the odd vagrant wild boar in the countryside, and I think they've been dealt with, but for the most part in Europe, this has been confined to Eastern Europe and parts of Germany. So thankfully it hasn't reached our shores, but I think it still emphasised the need for vigilance, and particularly I think the issue is among not so much our commercial pig herds, where people are, as you say, are well versed in it and know the precautions, but we are particularly concerned about smaller backyard operations. And during the course of our webinars, we're going to have a talk on African swine fever and emphasize the importance of good biosecurity once again for that. But again, I know I'm preaching to the choir here, in the sense that most of your listeners are well versed in this disease and are have the precautions in already.
Thank you very much, Damien and Caroline. I suppose a lot of changes and challenges are coming down the line for pig producers, and I suppose perhaps they can get some information or some answers at the events over the week for World Animal Health Awareness Week. Thank you.
Thank you.
Thanks very much.
That's it for this episode of The Pig Edge, and many thanks to Caroline and Damien for joining me on the show. Don't forget to listen and follow on Apple, Spotify, or wherever you get your podcasts from, so you never miss an episode. And for more information on the Pig Development Department, go to teagasc.ie/pigs and follow us on Twitter at @teagascpigs. I'm Amy Quinn. Thanks for listening.